So I have Dr. Alex and Dr. Kenya of Smile Theory Dental, and we're discussing the world of dentistry in the middle of COVID-19. How have you all been surviving just personally?
It's an adjustment. I've been doing well, practicing social distancing, of course, just trying to stay safe and healthy. It's just me, my parents and family, they're at their homes and we FaceTime and do like little Zoom parties to kind of, you know, see everyone and check in. But for the most part, I'm okay.
How are you, Dr. Alex?
I'm doing well. I'm a little bit of an introvert at heart so I think I'm faring a little bit better than some of my truly extroverted friends, but I take my dog for a walk every day, and keep in touch with family and friends with this Zoom and with FaceTime. It's an adjustment, but I think it has given us a lot of time to prioritize what's important. So I've been doing a little soul searching and getting outside, practicing social distancing. So I'm trying to focus on the positive.
I love that soul searching. I think everyone is soul searching and probably thinking about all the things that they need to prioritize and that's not as important when what is important. But you two are amazing dentists. And we know COVID-19 is airborne. I want to know, and I'm pretty sure others and millions want to know, how has this so far impacted the field of dentistry? What are you all doing first and foremost? When you first, we got the word, what are you two as two, business owners of Smile Theory Dental? What are you doing first and foremost to inform your patients? What are you saying to your patients and clients, which is the same thing, patients and clients?
It's something that is, I think, going to change how we communicate and how we, operate with patients moving toward the future here. But, first thing that we did as doctors and practice owners was communicate with our patients. This is what's going on. And, in order to keep you safe, here's what we're recommending. And we kind of relied on the local guidelines and the guidelines from the American Dental Association, which really at this point are recommending that because it is airborne and there's a lot of aerosols in a dental office, that we limit our practice to emergencies only. That way we're reducing our impact on the spread of COVID. So that was our primary focus, was to make sure that we as an office and just as dental professionals don't contribute unnecessarily to the spread here. Beyond that, it's making sure that our patients stay informed with how to take care of their teeth, how to get in touch with us, and kind of changing and shifting over to things like teledentistry or phone consults,
wow,
communicating on social media. So it's definitely a change, but people have been receptive.
Teledentistry, that, like everyone else, all the doctors are now doing these doc's appointments via phone. Kenya, Dr. Alex mentioned American Dental Association that you're receiving your guidelines. And some of the questions that people have asked and are concerned about, as you follow the American Dental Association guidelines, what do people do if there is a dentist emergency? Is dentistry allowed, and to what extent?
Right.
So are they going to have to come, if it is an emergency, what does that look like? Is it in the dentist's office, or are you now required to go to the hospital?
So basically, we have these mandates and guidelines that certain organizations are giving out to the dental world. The Illinois Department of Public Health, we're mandated, like you said, to only just see emergency patients and to provide emergency treatment. We're also taking recommendations from our governor and also the ADA and the Illinois State Dental Society. So basically, if a patient calls and they have an emergency, we will do something like a teledentistry, as Dr. Alex explained, to kind of figure out what's the emergency, what's causing them the discomfort. And then we would take it from there. Either we would go into the office if it's a situation where there's a temporary restoration, because there's different levels of emergencies, right? So if it's something like a temporary restoration that's failed, meaning a temporary, and it's associated with some type of discomfort or pain, then we'll go into the office and remake a temporary. If it's something like throbbing pain with extreme sensitivity to hot or cold, we would speak with the patient and then refer them to the specialist, such as the endodontist, or if a tooth is cracked or fractured and we can't restore it, we'll send it to the oral surgeon. Now, if the patient is unsuccessful in general in reaching their dentist, and their emergency or their tooth discomfort is associated with some type of fever or abscess or facial pain, and it's not subsiding and they can't get in touch with a general dentist, then definitely that patient should seek medical attention, whether, it's in the ER or they're consulting with a medical doctor if they cannot reach their dentist, because the whole point of it all is to try to keep, patients from flooding to the emergency rooms. So it's very important for us as dentists in the dental world to talk to our patients and keep the lines of communication open, so we can treat them for these emergencies.
Yeah.
Dr. Alex, is getting your wisdom teeth pulled, is that considered an emergency if they're having that throbbing pain that Dr. Ken just mentioned? And wisdom teeth hurt and it causes a lot of headaches. So how are you evaluating if it's really needed, or are you looking at their pain level? What happens when someone calls you regarding wisdom teeth or even a cavity?
Right. And there's a lot of times we say there's no pain like dental pain. Each tooth has its own individual nerve and it's right by your head. And so, yeah, we do get a lot of referred pain, things that will start out as a toothache and kind of all of a sudden now you have a headache, or all of a sudden you have a swelling. So that's where this teledentistry really comes in. We're able, if I can see your face, I can at least kind of evaluate, is there some facial swelling? It's really important, like Dr. Kenya touched on, is just to kind of triage and decide, okay, is this something that can be at least partially remedied with something like over-the-counter medication, ibuprofen? So we'll discuss the at-home remedies with the patient, check back in. If we don't think that that's something that is going to get any better, or the patient is going to otherwise end up in the ER, which is what we want to stay away from, then for sure we talk to the patient, either to advising him or her to come in, or referring the patient to a dental specialist, maybe an oral surgeon, so that a wisdom tooth or a cracked tooth or infection can be addressed before it turns into something systemic, which would maybe cause a patient to go into the ER and cause some more, put some unnecessary stress already on a highly stressed medical facility right now. So that's kind of our goal, is to just talk to the patients. What's your pain threshold, or what is the pain feeling like? Can it be something that might be remedied with some at-home therapy? And if not, we want to take care of you or get you in to see a specialist in the dental field.
So you two wouldn't handle that excruciating emergency. You're going to refer them to a specialist?
Well, it just depends, again, on the level of emergency. So you can have excruciating pain with a temporary restoration being fractured, or you can have excruciating pain if a tooth is fractured and you need a crown. Or you could have extreme cold sensitivity if a filling or a restoration came out of the tooth. So it just depends on what that emergency actually is. Mm-hmm. So things such as what you said, wisdom teeth, and sometimes, you won't get throbbing pain associated with a wisdom tooth. It just depends on the situation.
So if it is a deemed emergency, as we're discussing now, and you're like, okay, they really do need to get this tooth taken care of, is it you all going into your offices to take care of it and now you're covered up? Or is it like, no, you're going to the hospital and we'll meet you there and we're going to isolate you?
That's a good question. Right now, it's the patient coming into our office, and we're taking, as many extra precautions as we can. But as medical and dental professionals already, we've for decades been exercising universal precautions. So my dog right here.
I see. We have to guess.
Yes. So our objective has always been to keep our patients safe and to keep the transmission of germs, bacteria, viruses at an absolute minimum. So they're coming in to see us. What's also another great thing about where we're located, which is downtown on Michigan Avenue. We are lucky enough that our physical building houses dentists and dental specialists. So in the event that, we would need to consult with an oral surgeon if a patient came in and I'm looking and thinking it may be a more specialized or advanced case, we simply, consult with our doctors in the building and we're able to walk our patients down.
So what do you think, or how is dentistry going to look like going forward? Are you all now going to, once this, shelter at home is essentially lifted, what do you think that the world of dentistry is going to look like? Are you two, as dentists, now going to be required to always wear the N95 masks as you treat patients? Because, as I saw and read, you guys use a lot of tools that do spray, water droplets, and Dr. Alex mentioned that as well, the goals to lower the risk. What do you envision the way you practice will look like going forward in literally the next month or so, or even 2 months? And we see that some states are starting to open up.
Right. So, I think that with the inclination of COVID and everything is constantly changing every day, there's more information being learned about the virus. But one thing that's certain about dentistry is we practice by universal precautions for every patient. This is, before COVID even happened. The main concern is for our patients, their safety, and of course our safety as well as our staff. So, we're always wearing our PPE and following protocols and guidelines in terms of sterilization and following ADA regulations and OSHA regulations to provide that level of care for our patients. But things will change, in terms of us even screening patients, asking them questions pertaining to COVID. And have you experienced any flu-like symptoms? Have you traveled, been out of the country? Have you been around anyone that's been diagnosed with COVID? And even going so far to protect our patients as well, because again, that's our main concern. So, things will change in dentistry. The PPE will be ramped up. We will be wearing our N95 masks to protect ourselves as well as the patients.
Is the American Dental Association and ADA already telling you all that even once it goes back to normal, that you're going to definitely have to now, you two as doctors have to wear your masks no matter what? I know, your staff will probably have the cloth, but is that coming out, or is that what you're all hearing down the pipeline that going forward, you're probably going to have to wear?
Absolutely. So we want to make sure that we do have our N95 masks as well as our staff as well, along with face shields, gowns, our scrubs, our caps for our hair, and booties for, our feet to kind of prevent, do our part in stopping the spread or preventing anything transmission-wise of this virus.
Mm-hmm. Dr. Alex, how do you feel about that? That what she just described, what Dr. King just described, is like you're going in for surgery, like you're going in the ER room, which is essentially is going to be the new normal. I want you both to ask this question, but how do you feel? Are you worried? Are you scared? Because it's almost like you as dentists are the first it's airborne. So how does it make you feel?
asked myself that question over the course of these past few weeks as, you know, we're engaged in a lot of local groups and national groups. And as dentists, we come together as dental professionals. We want to keep our patients safe. We want to keep our staff very safe. So I've asked myself these questions, and, you know, I was directed to an article that kind of started to put things in perspective. And in like prior to 1980, it was actually common practice for dentists to not wear gloves. And sterilization practices were a little more lax than, you know, they are today. And what changed that was, you know, was really the HIV and AIDS epidemic that happened around that time. And in order, you know, just like COVID right now, in order to do their part in the dental community to reduce the spread of HIV and other bloodborne pathogens, the guidelines changed. So dentistry coming out of 1980, the early 1980s looked completely different. They were wearing gloves. We were sterilizing our instruments much more differently, and things were being measured. So, you know, prior to 1980, bloodborne pathogens really weren't, sounds crazy, but they really weren't on the radar for dentists. And so now in 2020, what that looks like is, you know, airborne pathogens and aerosols. It's new, but this, you know, adaptation is not new to dentistry. And so it is going to be a new normal. But as dentists and as medical professionals, this is what we do. We stay up to date with the trends, and the outcomes are always going to be better and more beneficial for the patients, for the dental staff, for the dentists and the general public as we become more aware. So I'm actually excited about the changes in dentistry, because I think long-term we're going to see some other benefits that, just like we saw with the HIV and bloodborne pathogens, how it actually is created a more healthy environment for our patients. So yes, it's going to change, and we're going to look like we're scrubbing in for major surgery. But, you know, ultimately, this is going to have a better impact globally, I think, and locally, making sure that we keep everybody safe, ourselves included.
You're getting ahead of it. It's like you're helping to curb it by taking even taking more precautions. And I got chill bumps when you brought the 1980s with the HIV. You put it into perspective, because you saw the increased amount of protection and sterilization, which probably should have been done. To think about that your dentist wasn't using gloves and touching your mouth is wow. It took for a national pandemic to now look at how you are doing medicine and practicing dentistry. What advice, Dr. Kenya, what advice, and both of you all answer, tips would you give to your clients, you know, now? What tips, best practices in protecting themselves?
You know, I would just probably, you know, recommend my patients to, you know, follow the guidelines, you know, try to stay up to date on the information that's given to us through, you know, our governor, and to also practice social distancing, right? And just to, you know, it's hard because it's just a hard trying time right now. A lot of people, or some people, are probably starting to feel a little down about things, and they're probably looking at, you know, our future and how does that look, and, you know, in particular, our patients may be concerned about, you know, how are we gonna, you know, get our dental work completed? How does that look? How does us even going to see our medical doctor, how does that look in the hospital? So I would just encourage them to just continue to follow the guidelines through our governor, wearing masks that we're supposed to wear out in public, practice the social distancing, sanitizing, including, you know, washing your hands, and just, you know, just be encouraged that they're gonna go back to our new normal, but it will get better. And yeah, just, you know, if you're a person of faith, know that things will get better.
Have you all gotten those scary calls, and how have you handled? How are you all keeping the peace with your clients as well as staff?
Yeah. I think it's important to, if you are concerned, if you're a patient, and you're concerned or you have questions, I think it's really important at this time to reach out to your dentist and just ask. We've been sending out, I think, kind of biweekly emails, trying to engage, I think, more with our patients, like I said, on teledentistry. But it seems like, day to day, we're kind of getting these updates. And so I think everyone kind of understands that there's a lot of unknowns right now. But what we try to do is get ahead of, try to get ahead of those fears and just assure our patients and as well as our staff, because they're worried too. Hygienists, they are, really right in front of it every day for, however many hours a day. So we want to make sure that what we're doing on our end is making sure that we get the right PPE that's actually effective. We're looking at evidence-based research, making sure that, we're not just putting things in place that sound good, but that are actually effective.
Digesting or inhaling products that's made for household cleaning that you're not advising to.
We don't, right. Evidence-based research, okay?
Okay.
So we want to make sure that what we're recommending has actually been proven to work. And, I think doing our part, like with social distancing, we're probably going to stagger out our appointments. There's, we keep our appointment, no one ever really waits in our waiting room, but for now, and I think the trend that we're going to see in dentistry is, really limiting the number of bodies, both on the staff side and as well as the patients who are coming in and out, and providing opportunities for our patients to making sure they're washing their hands, sanitizing, providing masks where indicated, so that even in the office, we're not contributing to the problem.
PPE, is that the responsibility of you two as the owners, or are you getting equipment, masks from the American Dental Association or the Illinois Department of Public Health?
So we are responsible for providing that PPE for our staff and ourselves and our patients.
Okay.
In which, we have our particular vendors that we, work with to provide our PPE and our dental products and things of that nature. So.
Last question, is there any, I don't know, I'm thinking of peroxide. Is that, I know you say proven things that's worked. Is there anything else we could do at home, as, patients to protect ourselves from the airborne other than social distancing and, wearing masks? I don't know I don't know why I keep thinking about gargling peroxide, but does any of that stuff, does that work? Is that helpful?
Yeah, all of those things that you mentioned, honestly, Rashanah, are certainly going to be beneficial. And the peroxide really comes from creating an environment where the virus is going to be less successful to aerosolize. So the peroxide is good, but always do so under the recommendation of your specific dentist. So there may be a situation where that wouldn't be recommended for someone with maybe a certain condition or who's using certain medication. So always consult with your dentist or medical provider before you implement those changes. But certainly all of the things that you mentioned, wearing the mask, social distancing is really what we know to be the main the main thing that actually will stop the spread, is just making sure that you're self-isolating and, and making sure that you're taking care of yourself so that you don't put yourself in a position where you may end up in the ER. So that goes as far as, being safe just around the house, as well as taking care of your teeth, brushing, flossing, eating a healthy diet.
How many times a day should we be doing? Is that every other day since we're in the house?
Every other second, because everybody's snacking every 2 seconds.
I know. Is that a concern that we may see more like cavities? So what should we?
For sure, 100%.
So how many times should we be brushing now and flossing?
As often as you're putting that snack in your mouth.
Okay.
Ideal flossing would be, after every meal, of course, because you can get that food out of there, but at least before bedtime, flossing once. That's what the ADA recommends. And then ADA minimum recommendation for brushing is 2 times a day, at least for 2 minutes per session.
Anything else you want to add?
I just want to encourage everyone to just, know that it will get better. It will get better. And, the importance of social distancing, the importance of wearing your mask and not putting yourself in harm's way, and just being really mindful, especially if you're younger, being mindful of the elderly population and your family, and just to be safe overall and to protect yourself.
Yes. Okay. Thank you so much. And I look forward to talking to you all soon.
Thank you.
It was a pleasure.
So much.
Bye.
Stay safe.
Stay safe.
Bye.